Rajeswari, consultant gynecologist at Magna Clinics, Chennai. Today I'm going to discuss about a few points on PCOS or polycystic ovarian syndrome. So everyone know about polycystic ovaries as such. So patients come to me telling I have polycystic ovaries. So I just wanted to make certain things clear that just having polycystic ovaries in ultrasound per se doesn't mean that the patient has this polycystic ovarian syndrome or the PCOS. So just wanted to brief on what is PCOS and what are the clinical manifestations and what has to be done. So I just wanted to tell. So polycystic ovaries, so the definition goes like the patient should have at least two of the following three criteria. So the three criteria includes ultrasound evidence of polycystic ovaries, menstrual disturbance, that is in form of anovulation or oligoovulation, as well as if they have the clinical features of hyperandrogenism. So this is the diagnostic criteria, and incidence approximately it affects 4 to 18% of the patients of reproductive age group. And coming on to the cause or etiology, exact etiology is unknown, but yes, it has a certain amount of genetic basis in the etiology. And also today the changes in the lifestyle, like in the form of eating more of junk food and obesity. Obesity is one major predisposing factor for this. So obesity, and the basic pathophysiology behind obesity is insulin resistance. So as a result of this, the patient suffers from polycystic ovarian syndrome. So what are the clinical features the patients come to us is, it might range from disturbance in menstrual disturbance, like oligomenorrhea or irregular menstrual cycles, or they can have thinning of scalp hair or acne or other things like this. Okay, so and also issues in fertility. So that is another important thing that patients come to us. Most of the time they come to us having difficulty in conceiving, and then we diagnose with this condition. So these are the clinical features which the patient usually and the complaints the patient comes to us. So the treatment varies widely from simple lifestyle modification and medical management, and lastly the surgical management, of course. So the first is the lifestyle modification. So weight loss. Just by losing weight, the patient can significantly improve the outcome in this disease. So they can significantly decrease the time required for conceiving. So weight loss is the mainstay of treatment, as well as the lifestyle modification itself is the mainstay of treatment for polycystic ovaries. So along with that, what are we going to give them? So it depends on which complaint the patient comes to us. So if they are going to come for menstrual disturbance, then we are going to treat them with oral contraceptive pills. And if they are going to come with alopecia or thinning of hair, then we are going to treat them in conjunct with the dermatologist opinion. And if their problem is acne, then accordingly the specific oral contraceptive pills and other cosmetological procedures we will advise them. Then if their issue is infertility or difficulty in conceiving, then apart from lifestyle modification, we also give them ovulation induction agents and then follow up accordingly. So very few aspect of patients, very few percentage of patients, they have difficulty in conceiving in spite of the medical management. So for them we would